The spine is a central part of the body. It keeps us standing upright and connects different parts of our skeleton, but most importantly, it protects our spinal cord. This column of nerve tissue runs from the base of the skull down to the low back and connects our brain to the rest of the body. Since it's such an essential component, it's no surprise that the spinal cord is protected by 3 layers of tissue along with the solid bone of the spine. However, it's not invincible. More than 300,000 Americans are currently living with the spinal cord injury, and there are around 18,000 new cases each year. Dr. Daniel Michaels says that even a slight incident can have major repercussions.
The spinal cord injury connects the brain with the rest of the body via nerve cells, and following the injury, nerve connections are lost, and this can result in a range of symptoms, including loss of muscle function, strength, loss of sensation, loss of bladder and bowel function, as well as sexual function. So it's a whole range. It really depends on the level of the injury within the spinal cord, what symptoms occur, and the severity of the injury to the spinal cord.
Michael is a neurologist and chief medical officer at NerveGen, a biotech company. Unfortunately, there aren't many options when it comes to recovery. If there's damage to the spine itself, surgery is often required to stabilize the bone and remove any pressure that's built up, since that can cause further damage.
And then it's really a matter of rehabilitation. So right after spinal cord injury, the patient is going to have some deficits depending upon, again, the level and the severity of the injury, and they have to learn to cope with that and to try to maximize recovery.
Patients will first undergo an inpatient rehab program while they recover from surgery. After they're released from the hospital, they'll switch to outpatient rehabilitation.
They'll come back for a period of a couple of months or 3 months to undergo further rehabilitation. Sometimes it's even longer. And there can be recovery. The spinal cord does have the capacity to repair itself to some extent. So there is some spontaneous recovery, and people can learn to function despite some of their limitations, but unfortunately it's very incomplete. And beyond rehabilitation, there's certainly nothing approved by the FDA to restore connections and to result in improved function after spinal cord injury.
Since there's often no chance of having a complete recovery, the rehab works to improve the functions the patient has left. For example, if the patient has limited hand movements, they'll work to be able to hold an object or open a door. However, in rare cases, there is a possibility for new nerve connections to be formed, but it's often blocked by the body's healing process.
So after a spinal cord injury, there's a scar that forms, and this scar actually does help to protect the spinal cord from further injury. But the downside is there are substances in the scar, inhibitors, that inhibit nerve repair. So there may be some very low level of spontaneous repair that happens. And with rehab, we're trying to take advantage of that and get the most out of it. But the other approach that we're taking is with NVG-291, it has been shown to promote nerve repair in our early studies.
NVG-291 is a peptide that blocks the substances which are stopping the body from repairing the damaged nerves. Essentially, it's helping the body fully complete the healing process. The drug has been approved by the FDA's Fast Track program, which speeds up the development and review of products that treat serious conditions or fill a gap in medicine. NVG-291 has been previously tested in rodents and shown really promising results in terms of muscle function.
What has been seen is that in different models of spinal cord injury, NVG-291 has been shown to improve mobility, ability to get around, as well as improve the ability to function with the hand, such as in grasping. The previous experiments have also shown improvements in bladder function, which, aside from improving muscle strength and mobility, that would be great. Even if a treatment can just improve bladder function, that can be a huge importance, improving the quality of life of a person living with spinal cord injury.
In the preclinical trials, 100% of the injured animals had partial to complete recovery of bladder function. Another promising result revealed that these benefits happen even if the injury occurred years before. The researchers have now moved testing into humans and are studying 2 groups. The first includes patients 1 to 10 years past the time of their injury, and the second group has experienced a spinal cord injury within the last few months. Both groups are still open for enrollment. It's a 16-week trial hosted in Chicago, and NerveGen is providing housing and transportation support to anyone interested but unable to afford the travel. After finding positive effects in animal models, the researchers are eager to see how the results translate to humans. During the study, they'll be able to see if the drug is working by measuring the electrical connectivity.
If you try to move a muscle, your brain will send an electrical impulse that goes down through the spinal cord, and your muscle will contract. As humans, we have control. We have voluntary muscle control. We can measure that electrical impulse that goes through the spinal cord and reaches a specific muscle. And if there's been complete loss of the connectivity, we won't see any electrical activity in the muscle. But if there's some connectivity, we'll see it. And of course, if there's full activity, we'll see that. We're taking a pragmatic approach by measuring the extent of connectivity between nerves and ultimately the muscles in the arms and the legs. And this, if we see improvements in the connectivity, this should translate into improved function.
They'll also be measuring physical traits such as hand function and ability to walk. If this research goes well, it could change the way we treat spinal cord injuries.
There's been no success in clinical trials of spinal cord injury to date, really, that has led to a promising treatment. We're taking, I guess, a conservative approach because we'd love to see improvements in function, hand function, walking. This has been shown in some of the preclinical studies, but we don't know what's going to happen in humans. So we're also measuring electrical connectivity because it's much more sensitive, it's objective and quantitative, and it'll give us information that the drug may be working even if we don't see gangbuster effect on the clinical measures in this very first study.
If you've been impacted by a spinal cord injury and are interested in participating in this study, go to connectscistudy.com. You can find more information about Dr. Daniel Michael and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.